Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for Thursday, December 31st, the last briefing of 2020, and I believe the 160th briefing. We're honored to be on the territories of the Musqueam, of the Squamish, of the Tsleil-Waututh people. We're honored to give this briefing on their lands. I wanted to say that there won't be a briefing or an update tomorrow, January 1st. We will be back in Victoria on January the 4th, which is Monday, and on that day we'll also be providing a detailed briefing presentation around the vaccination plans and so on, which are evolving. So with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you very much and good afternoon. Today we report 683 new cases here in British Columbia, including 2 epidemiologically linked cases, bringing our total number of cases of COVID-19 to 51,983. That includes 105 people in the Vancouver Coastal Health region, 447 people in the Fraser Health region, 11 people in Vancouver Island, 64 people in the Interior Health region, 36 people in the Northern Health region. I will say that there has been some over-reporting due to a data system change from Northern Health, and those numbers will be reconciled over the next few days on the dashboard on the BC CDC website. But the numbers for today are 36 new cases. That gives us 7,803 active cases now in British Columbia, of whom 374 are in hospital, 76 people in critical care or ICU. We have a little over 9,364 people under active public health monitoring, and again, due to the data system change in Northern Health, we're still catching up with those numbers. We also have 42,129 people who have recovered from COVID-19. In the last day, we have had 8 new deaths from COVID-19 across British Columbia in the Fraser Health and the Northern Health region, bringing the total number of people who have died in 2020 from COVID-19 to 901. 901 of our family, our friends, our neighbors, our community people. And our deep condolences go to all of the families who have suffered losses this year, all of the care providers and our communities who mourn with you. We have 3 new healthcare facility outbreaks at the Williams Lake Seniors Village, the Ridge Meadow Hospital in Fraser Health, and Langley Memorial Hospital Long-Term Care, also in Fraser Health. And 2 outbreaks have been declared over at the Saanich Peninsula Hospital in Vancouver Island and the Bamfield Pavilion outbreak in Vancouver Coastal Health, leaving us with 52 active outbreaks in long-term care and 9 in acute care, and involving 1,412 residents and 733 staff. In addition, the Bighorn Hotel community outbreak has also been declared over. On a positive note, for our vaccine update today, to date, as of yesterday, we had provided immunizations for COVID-19 to 17,510 people across BC in every health authority and every health region. And they have all received both the Pfizer vaccine, and as of the last 2 days, we've also had Moderna vaccine, the second vaccine which has been approved for use in Canada. And that has been increased our ability to expand immunizations even further. And on a very positive note, we've had the first immunizations in some of our more at-risk remote and rural communities, including some of our First Nations communities across British Columbia, and it's a very happy moment for all of us to be able to protect the elders and seniors in these communities. As has been the case since the start of this pandemic, The fewer faces and bigger spaces that we are in, the better. That means less risk for all of us. And right now, we have been trending in the right direction for the last few weeks, although the increase today reminds us that we are still in a very precarious situation. And we can only look around us, whether it's other jurisdictions here in Canada, around the world, our partners to the south, where we see this virus continues to wreak havoc and to cause illness and death. As the new year brings a fresh start for all of us, we must start 2021 in the right space, on the right foot. And the only way we can get there is for all of us to continue to stay small and stay local, particularly for our New Year's Eve celebrations tonight. Yesterday, I amended an order to ensure that places like restaurants and bars and liquor stores stop serving or selling alcohol at 8 p.m. The rationale behind this step is simple. Alcohol, as we know and as we have seen far too many times this year, limits our inhibitions. What can begin as a quiet dinner with our household or a drink with a friend can too easily get out of control. And sadly, we have seen that happen even in the past few weeks. When that happens, rules can be forgotten, and servers and restaurant staff are the ones who must enforce these rules for the safety of everyone, including the staff. I have heard, unfortunately, about holiday celebrations being planned, some for several hundreds of people. And I've heard from many who work in BC's restaurants and bars who were worried about their ability to manage those situations, particularly on a night like tonight when there was a build-up for a number of these occasions. I recognize absolutely that these restrictions are yet another challenge the restaurant and the food service industry has had to face in what has already been a very tough year. But 2 hours now is necessary for us to manage a situation that is going to be lasting for many more weeks. We have worked very hard to make sure that restaurants are able to operate safely, and they have done that over the last few months, when in jurisdictions all around us, they have been closed down for in-service. We know that they can operate safely and that we can use and benefit from them. But right now, we need to hold the line. And that's to make 2021 a brighter year for all of us so that we can get back to full business for everyone as soon as possible. I am confident the small step that we took will help us start the new year on a healthier and safer note. I also think it's important to look back on the year and realize what we have accomplished by working together, that we can all still celebrate in a smaller way tonight. I know that some people's plans have changed for this evening. One of my team members, for example, canceled her 9:15 reservation for dinner at her favorite local restaurant. But she and her partner are now going there on Sunday instead and spending tonight at home. And I would encourage all of us to think about that. It's not just about tonight. It's about supporting our local businesses, our local restaurants, our local pubs over the coming weeks as well. As we've done a lot to keep our restaurants open safely, it needs to be more than just tonight. Many of us will be ordering our favorite meals in, myself included. Others will be having games nights in with their households or celebrating with friends from around the world through a virtual party. Whatever your plans may be this evening, please remember how important it is to follow the public health orders and restrictions. The actions of a small group of people, as we have seen before, can have consequences. Not only for them in the form of potential fines, but also, as we have seen, with people ignoring orders. But also for the majority of people who are doing the right thing every day to keep their neighbors, their families, their communities safe. By staying local, keeping our circle small, and following provincial health orders, I know we will start this new year on the right foot. 2020 has been hard on us. It has been hard on all of us. And this is no consolation for those many who have lost loved ones to COVID-19, to the overdose crises, for those who have felt lonely in isolation or lost employment or a treasured business. At the same time, COVID-19 has shown us in BC that we can make a difference and bend that curve when we work together with a common goal. My hope is that by this time next year, we can look back at the sacrifices we made, big and small, and know that we made it out of this pandemic together by staying apart, by connecting remotely, and by following the rules. Every time you choose to do the right thing, you are potentially saving a life. This includes how you choose to spend your New Year's Eve. Let's turn the page on 2020 in the best possible way. COVID-19 may define 2020, but it will not define us. As we came together in adversity in BC, in the face of this global crisis, what will define us is how we did that in kindness, with compassion and caring for each other, and with resilience. I wish everybody a happy and a safe New Year, and may 2021 bring us all more certainty, more happiness, and health. And may we continue in the way that we have by getting through this together, being kind and being calm and being safe. Thank you.
Thank you very much, Dr. Henry. And I wanted to start by recognizing and sending my condolences, those of the Premier, those of really everyone in BC, to the families of the 8 people who passed away from COVID-19 in the last 24 hours, 7 in the Fraser Health Authority, 1 in the Northern Health Authority. It's, as Dr. Henry has said, an extraordinarily difficult time for caregivers, for family, for friends, and to lose a loved one. And we want to say to all of those people, all of those families, and the 901 families of people who have passed away this year, that we're thinking of them today and that we hold them dearly in our hearts. I wanted to note at this time of the year the extraordinary work being done by people in our healthcare system, by our healthcare workers, our healthcare professionals who are doing, I think, extraordinary work at this time. We have 7,803 active cases of COVID-19. We have 374 people hospitalized with COVID-19, 76 of them in critical care, 9,364 people under public health surveillance. Add on to that the numbers from Northern Health. And I wanted to also acknowledge the extraordinary work being done from the beginning of this year, but especially from March, of the people who work at 811, who have been, for many people, a lifeline in these times of information and help and an assistance when help was needed. I'd note that last year in 2019, 811, which is already an important and popular service in our healthcare system, answered 445,117 calls last year in 2019. This year they have answered and spoken to 910,004 people, essentially double the amount they did last year. That is, I think, the level of response, the fact that we're responding, I think, to 99% of the calls, that the call response really, since adjustments were made in March and April, has been extraordinary. I want to just pay tribute to everyone who's been involved in that, and I think that people who seek help from 811 would echo those comments, and I'm so appreciative of our workers and our team there. Also want to note that we've added new people working as contact tracers in the province this week, another 22. That's 1,297 people have been hired since the program was announced by the Premier at the end of August. Our original target was 500. Our final target was 1,224, and more than 100% of that target is complete. In addition to that, we approved the First Nations Health Authority to hire 76 community health representative positions to support culturally safe contact tracing. and that as of Friday, December 18th, 1.5 million of the 2.5 million on that initiative has been spent and or allocated to regions and is in the hands of communities. All new hires will go through a training program that is centrally coordinated by the First Nations Health Authority and will include modules on public health, privacy, confidentiality, trauma-informed care, harm reduction, and infection prevention and control. We continue to look at building our public health teams in this time and what's going to be an extraordinarily busy year. We have 362 further candidates in the interview stage and 123 candidates in the offer stage. I wanted to note that in our acute care hospitals at present, of our base beds overall in the hospital system, we're at 84.8% capacity, very similar to yesterday. That means vacant beds in our base complement of beds are 1,424 that are, those are the available vacant beds. That our overall capacity, when you add surge beds to that, we're at 66.7% occupied right now, which is leaves 3,977 vacant beds or beds that could be used in the coming weeks and months should that be required. In critical care, the capacity is currently 74.7%, and that leaves 132 base critical care beds that are available that are effectively vacant at the moment. And when you add our surge beds, that number goes up to 376 as we are at 51% occupancy. So what that continues to mean is that while we have a significant number of people, obviously with COVID-19 in our hospitals today, that number is 374, that we have capacity, and this is to a degree the difference between British Columbia on the acute care side and other jurisdictions. We continue to have substantial capacity to do that. That said, people in acute care, everyone working in acute care, is dealing with an extraordinary situation, and have done so, I think, in a way that we can all be very proud of, that represents, I think, something that all British Columbians can be proud of. Next week, along with Michael Marchbank, who's heading our surgical renewal commitment across British Columbia, we'll be reporting in detail on the last number of months and on where we are in detail with the surgical renewal commitment that we made, that the Premier made on behalf of the government in May. And I know you'll be looking forward to that briefing, which reflects, while all of this is going on, the remarkable work done by everybody in the healthcare system in this time. In closing, we're preparing, of course, to close out a year, and it's been a year of great loss for many people. For many people, that loss has been more than others. They've lost members of their families. 901 people have passed away from COVID-19. It has been, let's just clear, a terrible year in our other public health emergency with the number of people passing away. A lot of that for them is someone they loved and someone they grieved for. And we know, we all, I think, especially those people, but all of us, end the year changed for all that has been lost. But we've also ended the year with, I think, significant resilience. We've shown that our actions matter, and with knowledge that our kindness, our generosity, our selflessness, and our strength make a difference. In the end, 2020 was a year where we showed a willingness, an unending commitment to achieve one purpose, to save lives. That when we stand apart, we save lives. That when we wear masks, we save lives. That when we stay home when we're sick, we save lives. And that we shop local under COVID-19 safety protocols, when we dine local and stay local, we save lives and support our communities. We save lives when we stop for a moment to think on that. And at a year-end gives us license to do that. We see the awesome power that we have, every single one of us has, in our BC pandemic, and the care we've taken with it. To me, of all the things that bode well for the year ahead, for a better 2021 for everybody, the vaccines, our innovation, our adaptation, our spirit, it is the dedication, the consistency, and our persistence under adversity to save lives that offers the greatest hope for all that is possible. I thank every British Columbian for all that you've done, all that you've sacrificed in 2020 to save lives. And I wish everyone a better 2021. Aujourd'hui, nous annonçons 683 nouveaux cas qui ont testé positifs pour COVID-19 pour un total de 52 015 cas en Colombie-Britannique. Nous sommes attristés d'annoncer 8 nouveaux décès liés au COVID-19 pour un total de 901 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches durant cette pandémie. Parmi l'ensemble des cas confirmés de COVID-19, 374 personnes sont actuellement hospitalisées, dont 76 en soins intensifs. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you, Minister. And a reminder to the media to please press *1 to line up for questions. We will be taking one question and one follow-up this afternoon. Also, please do not mute your phones. You will not be heard until I call your name. We begin today with Keith Baldry, Global News. Keith, go ahead, please.
Hi, thank you very much. Happy New Year to both you and Minister Dix. I'd like to ask you about the restaurant industry's reaction to the change in the closing time. So basically, one of the chief criticisms from that sector is that they weren't given enough time. This was very sort of last minute from their perspective, and some had made expenditures based on an anticipated revenue stream that may not be there now. Just wondering what the reason was not to announce this earlier.
Yeah, we've been obviously signaling for some time about the issues around New Year's Eve and around the holiday season. So I don't think this came out of the blue in that respect. And we were looking for ways to do it that address the issue that we have been seeing continuously. And the issue really is that later in the evening, when people are drinking a fair amount, we tend to see groups getting together and it being very difficult to maintain the COVID safety plans in those situations. And we've also seen people being outside and accessing liquor from some of the private liquor stores, etc. So that was the issue that we were trying to address, and we did that by reducing the hours that alcohol is available tonight. So it doesn't affect the times that restaurants are able to serve food and they're able to stay open. It's just around the timing of being able to serve alcohol. And we did obviously consult with a number of people in the industry, and we recognized that many people had several servings and that restaurants have been doing a really good job at their safety plans. And I encourage people to think about, if you're changing your plans for tonight, for being flexible, support your local restaurants. You can go there safely with your household, with your close friends, and do that in the next coming days and weeks. It's not just about tonight and about 2 hours of not having alcohol tonight. It's about how we are able to manage this evening, but also going into the future.
Do you have a follow-up, Keith?
Yes, just curious why 8 p.m. was chosen. I know before 10 p.m. was chosen. Now it's 8 p.m. Was there science or data or some sort of studies that show or evidence that we've accumulated that suggest 8 instead of 9 or 7?
No, it was based on practicalities in many ways, and based on what we were seeing and hearing were the times that people were having seatings. So that gives most second seatings at restaurants are about 7:30. So that gave people the opportunity to order a bottle of wine or whatever you wanted to have with your meal. So it was trying to find a level playing field for where alcohol was being served, and making sure that we weren't having people from bars and from other events all going out onto the street or leaving venues later in the evening around the time that they would wait for New Year's Eve here for near closer to 12 o'clock. So we did want to move that up so that we, in discussions with municipalities and others, that became a critical time that we saw during other long weekends and celebrations when people all ended up on the street later in the evening. So if it's any consolation, it will be New Year's Eve in the Maritimes, and some people will be celebrating in this country at 8 o'clock anyway.
Thank you. The next question comes from Camille Baines, CP.
Hi there. I'd like to know what your plan is, Dr. Henry, for the resumption of NHL games in Vancouver and when that could happen.
So my part of that whole planning, as you know, was being consulted on the return to play and return to practice plans from the NHL, and along with my colleagues across the country, the 5 provinces that have NHL teams, we sent letters, as you're probably aware. My colleague Dr. Hinshaw from Alberta was writing on our behalf. So we have made suggestions to the NHL, which they have taken up, and we believe that those plans meet the safety protocols in terms of a public health risk, and that they are going to be managed if they're adhere to those safety plans, that those are safe from a public health perspective. So it's now over to the respective provinces to determine whether the NHL games will happen or not.
Follow-up, Camille?
Yes, thank you. How many doses of the Moderna vaccine have been received and gone into arms in First Nations communities, the 10 that you mentioned yesterday? And how many of that and the Pfizer-BioNTech vaccine are expected to arrive in BC more widely in the coming week or so?
Yeah, I don't have the exact number of Moderna that's gone into arms between yesterday and today. It's in the vicinity of several hundred doses, and we've had about 1,100 doses of Moderna arrive, and I don't have the number right in front of me, but it's...
14,400 is the total for now.
We'll have to get you those numbers offline, but we know the clinics have started and have run through yesterday and today. So it is happening even as we speak, and there will be clinics again tomorrow as well.
The next question comes from Cam Mitchell, CTV.
Hi, I'm wanting some clarification on why bars and restaurants was given less than 27 hours to figure this out when they've been planning for New Year's over, say the last month. A lot of places went out of their way to stock up on different foods and, beers and wines and such, and they're now kind of out on that, and it was kind of pushing them right up against the clock when they were planning to go to 10 rather than 8.
Yeah, so this is only about serving and selling of alcohol. The food, the dinners are all fine up until 10 o'clock, and, tell me that there's a huge difference in, that 2-hour window in terms of selling alcohol. So what we are trying to do is level the playing field. We know that this has been a challenging time period, and we have heard from people in industry that they were facing challenges with people planning to get together around the time of closing, and that it was later in the evening. So that's why we made the decision. I think we need to focus on what is still there. You can still obviously do takeout. You can still do some great meals in restaurants and local restaurants and pubs around the province.
Follow-up? Cam, do you have a follow-up?
Yes. This is in regards to masks. Do you need to have or present a doctor's note to be exempt from wearing a mask in public? We're just seeing a lot of people that sound like they're quote unquote being discriminated against when they have a physical or psychological or mental health disorder, and they're going into places they are told they can go because there is an exemption for not wearing a mask. So I'm just looking for some clarity on why or how some people can get around this mask exemption piece in the BC CDC and from the Ministry of Health.
Yeah, so we have said this from the very beginning, that there are some people who cannot wear a mask for a variety of reasons. Either they're too young, they have difficulty putting it on or taking it off. We do not want to put a mask on anybody who can't remove it on their own if they need to. And there are some people, small numbers of people with valid medical, psychological, mental health reasons why they cannot wear a mask. What we are saying is that people need to be accommodated. This does not mean that if I don't want to wear a mask, I can go and shop or go to receive services anytime I want. This means you have to, we as a business need to accommodate, and people need to understand that they cannot put others at risk. So there needs to be concessions made for people, whether that means shopping online, having somebody get what you need from the store and provide it to you curbside, or have you come back to have the service at a time when there isn't other people around, where barriers can be put in place and other measures can be taken. So this needs to be an accommodation on both people's side.
Thank you. The next question comes from Alana Shepherd, Glacier Media.
Hi there. My question is for Health Minister Deck. Thank you for taking my call, first of all. But I wanted to ask you about an interview that Premier Horgan had with News 1130 right before Christmas. He said he discussed his plan to spend Christmas with his son and his son's partner with you, and that you had told him his plan was okay. I just wanted to know exactly when this conversation took place, and just if you could tell me a little bit more about it.
Well, I think I've answered this question before, but I'm happy to do that again. I think a discussion with Premier Horgan, I don't have dates and times of the discussion, and Premier Horgan asked my advice on his circumstance. I don't think I didn't give him the best advice, and I take responsibility for that. But ultimately, he got it right and had dinner on Christmas Day with his wife Ellie, and that's kind of the end of that story. What did I do on Christmas Day? Well, I had dinner with my wife Renee Saclikar, and we had a very nice time. It was unusual. It was like lots of people. I didn't see my mom on Christmas Day, and she didn't see her mom on Christmas Day, but we got through that, and that's what we did, and that's what we'll be doing tonight together, and that's what we'll continue to do. So my encouragement to everybody is stay with your household. Tonight, especially, it's really important right now. We talk a little bit about the provincial health orders, and Dr. Henry talked about those provincial health orders a little earlier, about the orders around last call for alcohol. But I think what's important to recognize this week is that 85 people, now 94 people, have passed away from COVID-19 since Christmas Eve, that we have a significant number of cases, that we have 374 people in hospital, and we really need people to dig in right now as we prepare our immunization campaign with now more than 17,000 people immunized. But as we do that we really need everybody to dig in, and to follow the guidance of Dr. Henry on important questions like washing your hands, on important questions like staying apart, and on following provincial health orders. It's my expectation that everyone will do that. Absolutely everyone will do that, because it's important to do it right now, to dig in, to reduce the number of cases, and in particular, reduce the situation for people who are most vulnerable, people in long-term care and others who obviously are facing even more risks than that. So that's why we're proceeding as we are. We continue to live and learn. I take responsibility when I make mistakes, but just like every other holiday tonight, it'll be myself and Renee, and unfortunately that means that people who we visited on Christmas or New Year's for the last 30 years or so, we won't be doing this year, and that's just the reality of 2020. But we need everybody to do what we're doing, which is keeping it with our household, keeping it small, keeping it local, and as much as possible supporting our local businesses.
Do you have a follow-up, Alana?
Great, thank you.
Question comes from Mary Brooks, Island Social Trends.
Hi, thanks for taking my question. Dr. Henry, would it be fair to say that your BC policy is now that one dose of the mRNA type vaccines will be given when all the supply arrives, that you're not holding back any of the second dose at this time?
No, that's not entirely correct, and I think we talked about this a bit last week. What we have said is the first arrivals of the doses that we received in December and into January are going to be to immunize as many people as possible with their first dose, and because of when supplies are coming, it will be, this is still a 2-dose program, but we will be extending the period of time where somebody receives their second dose, and that's about 35 days rather than the manufacturer recommended 28 days.
Follow-up?
There was a question, or there was a statement a few weeks ago that 7,000 people would be hired for long-term care, actually probably a few months ago. Just wondering how many of those people have been hired for training to work in long-term care.
Happy to deliver that, but more than 1,000 people have been hired. There's 3 elements to that, but the first element, which is supporting infection control and enabling visits in long-term care, more than 1,000 people have been hired. More than $130 million has gone out in support of that, and so those efforts continue. I believe it's approximately 8,000 people have been cleared through the process now, so it's going well. We're on track, and I think on Monday I'll be providing a detailed response on the specific numbers, but all 3 elements of it are going, I think, quite well. It's obviously a challenging time for everybody in long-term care, but our commitment is for 7,000, that's to address some of the issues around COVID-19, to continue to raise staffing levels, and of course, over time, to replace people in long-term care as well. But 7,000 is a significant commitment, and we're on the road to doing it. The programs are in place, the training's in place, and it has a number of elements, including providing money in the first stages for hiring in long-term care. That's one element of it, but it also involves significant training as well. It's a significant opportunity. I encourage people in BC to find out information, to get involved through our website, because this is a sector where we need more workers, we're going to need more workers, and we have a pretty ambitious plan, but that also means there's very significant opportunities for people to do something really important, which is to do this work, which is some of the most important work anyone can do in BC today and every day.
Thank you. The next question comes from Richard Zussman, Global. Richard, go ahead, please.
Yeah, Dr. Henry, just following up on the question Camille asked. At the end, you said it's still up to the province to decide whether the Canucks will be able to play home games in Vancouver. So what's the timeline for that decision? And am I right to interpret based on your answer that decision hasn't been made yet?
I'll let you take that.
What we thought, Richard, would be very useful in dealing with the NHL would be to have our health officer, provincial health officers from across the country deal with them. I don't want to call it collective bargaining, but to discuss with them together, to speak with one voice. And that voice through letter was Dr. Hinshaw in Alberta, but it reflected the work of our health officers across the country. They asked for things of the NHL. The NHL, what the NHL has proposed has been largely deemed acceptable by them. We haven't given a final answer, but it'll be soon. But if you know the way that we've approached this, I think in BC, the weight of what's been discussed and the effort that's been made led on our side by Dr. Henry and our provincial health team, but by the provincial health officers across the country. I think their recommendation I would expect, and it's not my announcement to make, but I would say that those recommendations, which were unanimous from across the country, will be accepted here in British Columbia. So it'll be soon. It'll be in the next few days.
I do. For Dr. Henry, schools are set to return on Monday. We now have the variant of the virus in some semblance of British Columbia. We have no idea if there's any community spread. Will there be any modifications done at school considering the variant? In the UK, they are extending their Christmas break. I know it's probably too late for that here in BC, but would there be consideration given to a pause on in-school learning if we start seeing increase in spread of the virus here in BC, including the variants?
And as you mentioned, the situation in the UK has been extremely stressful, and they're under a very intense lockdown as it is right now. So a very challenging situation there. We thankfully are not in that position, and we are watching very carefully for this variant here, but we have not yet seen a lot of spread in particular. So in terms of schools, I mentioned a few weeks ago in November, we pulled together a school task force to learn from what we have been through in the last few weeks and to pull things together and to reestablish that relationship and the communications and the tools that we need to restart safely in the new year. And there are a number that was led by the Deputy Minister of Education, Scott MacDonald, and Dr. Reka Augustus. And so we have engaged in that process, and people are preparing to make sure that we can go back to school safely next week. And that is kind of exciting for lots of children, I know.
Thank you, Dr. Henry. The next question comes from Craig Takuchi, Georgia Strait.
Oh, hi, Dr. Henry. Thanks for taking my question. I just want to check if there is a surge in cases after the holidays, what conditions or elements would prompt you to consider further restrictions or extensions? And do you have a difference in priority of extensions versus restrictions?
Yeah, I hadn't really thought about it. We try and keep all of the options open, but clearly we're watching what's happening, not only here, but what's happening around the world. And, people in British Columbia are doing the right thing, and that has made all the difference for us. And we are seeing a decrease. Obviously, I've been concerned about the holiday season, about people coming together. Many small groups of people coming together leads to lots of transmission, unfortunately. And we're starting to see that. So it will depend on what we're seeing over the next little while. But we have leveled off at a number of cases that is still very concerning. We know that this virus can take off quickly. So we will be looking at where are the situations that we're seeing transmission, what is the impact of what has happened last weekend, and of course tonight and going into this weekend. So those are critical things. This is why we've put in the extra restrictions for tonight. We want to make it clear that we need, in this global pandemic where things are getting worse all around us, we need to pay attention to that. We need to keep doing what we're doing because we're on the right trajectory. We don't want to blow it now.
Follow up, Craig?
Yes, thanks. I was just wondering, is there a maximum threshold for which contact tracing can operate in BC? And if we reach that point, would you call off contact tracing, or would you have it continue on for information purposes? Because the reason I'm asking is a representative from Toronto Public Health was saying on the news that because contact tracing was called off, they didn't know where outbreaks or clusters were happening. So I was just curious what BC's approach would be.
Well, we recognize that this virus is one that is amenable to those types of public health actions like contact tracing, and that it is a key part of how we can control or at least understand where the virus is spreading, and that helps us take the measures that we need to take to control it. So very early on, we put resources into contact tracing, and as Minister Dix reported, we've hired thousands of people to support our contact tracing, and we started that in the summer when our rates were very, very low. And that has helped us. We have come up against the edge of us being able to do that effectively, particularly in Fraser Health a couple of weeks ago and in the north. And we are rearranging and supporting as a system in our public health system how we can support those areas when we have surges in different parts of the province. And the BC CDC has set up a contact tracing node that we can support, but there are limits to what we can do. So we are focusing, particularly in the north and in Fraser Health, we focused on the key high-risk environments. We've put together the school team that I talked about, as well as a workplace health team, because as we're seeing across the country, and we see here periodically as well, we do get quite large outbreaks in different workplaces, whether it's poultry processing, whether it's Canada Post or Amazon sorting centers, or whether it's related to the ski resorts. So We have been focusing on trying to identify those types of situations where it can spread widely to larger numbers of people, both in workplaces, in school settings, in healthcare, of course. And part of why we put in the restrictions on events that we have is because we were seeing so many clusters and cases related to private gatherings and social gatherings. So those social gatherings were what tipped us over the edge a few weeks ago, months ago now, I guess. So those are the things that we're looking at. So for us, we have put a lot of effort and time and resources into maintaining our contact tracing, and we have not yet been overwhelmed, but we have been on the edge a few times and are taking measures to make sure that we can support each other around the province. And we all need to do our bit, because we don't want to be in that position, because that makes it so much more challenging to curb transmission.
Just one or two additional things about where we stand. As I say, 1,297 people have been hired. A further 76 positions have been made available and will be hired by the First Nations health authorities. We received support from 70 FTEs from Statistics Canada in terms of our contact tracing. We also have 362 people at the interview stage and 123 candidates in addition to that at the offer stage. What we're looking at right now, because there are a significant number of candidates in the pipeline, is whether those new positions will be accessed for continued contact tracing work, or if there are other opportunities. And of course, we want to also be in a position to address attrition. But 11,189 people across BC express interest either directly to health authorities or to Health Match BC in being involved in contact tracing. And just to put this in context further, in Fraser Health, they've hired 603 contact tracers to date. There's a further 111 in the interview stage, and we've deployed 28 additional contractor tracers redeployed to Fraser Health from the PHSA, from their rapid response pool. So we continue to be, from all perspectives, very interested and very engaged in the strategy in BC, and other provinces have had different circumstances and different views on this, but we're very committed to this idea, and we're going to continue to provide resources in support of it.
Thank you. The next question comes from Lisa Codasco, CHLY.
Thank you. Good afternoon, Dr. Henry. I'm wondering if you can give us an update on where you're at with genome sequencing of the COVID virus that was found in BC mink, and what are the next steps in terms of public health?
Yeah, so we have been doing whole genome sequencing, as you know, on random samples and some select samples, mostly to help us identify new strains and also help us with managing outbreaks. So it helps us understand if there's been more than one introduction into a school or into a care home, and it helps us figure out how transmission is going between people. So I still do not have any new updates on any of the approximately 20 or so recent isolates that we have been sequencing of people who have traveled recently from international traveling, particularly from the UK. So we still have only the single confirmed variant, but I know there are, as I say, a couple dozen that are in the pipeline. It does take some time to do the whole genome sequencing, so we will, of course, let people know as soon as we get those updates, but I'm afraid I don't have any new information today.
Actually, I'm talking about the mink, the animals on the farm that you were going to do genome sequencing because of the issues raised by the mink, in Denmark, and the passing of the virus between humans and animals. Do you have any information on that?
I do, and I apologize for that. Yes, so we did do whole genome sequencing of, we had sick farm workers as well as mink on one farm, and they did have the same sequences, which tells us that the mink probably got the virus from the humans. And there were a few variants, but none of the genomic variants that we were concerned about that they had seen in Denmark, for example. So there has also been identified mink that had died from another mink farm. So when we detected the first case, the chief veterinarian and the Ministry of Agriculture was involved, as was CFIA and WorkSafe and our public health inspectors, and we did inspection on all of the mink farms in British Columbia. There was some mink in one additional farm that were ill and tested what we call non-negative at the Animal Health Centre here in Abbotsford in British Columbia, and those samples have been sent to the CFIA lab in Winnipeg as well. But we expect they will be positive. There were no humans identified who were positive on that farm, so we're not entirely sure. The investigation is continuing into how the mink were infected. So we continue to monitor all of the mink farm here in British Columbia. The outbreak at the one farm is in the phase where we have not had new cases for a period of time, but it's not yet been declared over.
Thank you, and we have time for one more question this afternoon. For everyone listening today, Dr. Henry and Minister Dix will release a statement with the latest information on cases, hospitalizations and outbreaks, which you can find at news.gov.bc.ca. For updated province-wide restrictions, visit gov.bca.ca/COVID restrictions. And for information about the province's new orders and pandemic supports, visit gov.bc.ca/COVID-19. And the last question this afternoon comes from Andrea Ross, CBC.
Hi there, this question is for Minister Dix. A restaurateur we spoke with today ordered thousands of dollars worth of perishable food for tonight, and given the reservation cancellations he's seeing now, he's going to try to open his restaurants tomorrow just to try to sell all that food. Will your government compensate restaurants for the revenue they will lose tonight as a result of the last-minute public health order around liquor sales? And if you can also provide this answer in French, that'd be great.
Yeah, I will say again that I encourage people to be flexible with their reservations, and absolutely if they don't feel they can enjoy a meal with late at night without alcohol, then tomorrow would be a great option, and I hope they can support it.
Thank you very much. As you know, there is a restriction with respect to new restriction with respect to last call. Essentially, people have to order and receive alcohol by 8 p.m. So it's not our expectation that we'll be directly compensating, no. But I would say this, that I think that the order, given what we know, is a necessary step to control the transmission of COVID-19. As Dr. Henry has said many times, it's for now, it's not forever. But these are important steps that we have to take. We've seen in the last week, we've seen across Canada, we've seen around the world the impact of COVID-19 in this period. We know, and our strength and our belief in the restaurant sector has been demonstrated many times, and Dr. Henry has led this, I believe, that people can go to restaurants safely. And I think we've demonstrated that to a great extent in BC. We're the only place west of the Atlantic provinces, anyway, where there is in-restaurant dining at present. So we're going to continue to work at that and work with the industry. I think the industry on balance has done an excellent job, and we're going to continue to work with them to try, because I think what they do is important and essential, which is serving food to people, is an important thing to do. And we encourage people today to get takeout, and over the next number of days, and to shop local and to eat local where possible. So en français, je dirais que, and just one more thing that I didn't mention, because I think this question has been raised and was raised, is that tomorrow there will be immunization clinics in every health authority but one. The Vancouver Island Health Authority, which has used up all of its Pfizer allocation that it presently has. So they obviously won't be having a clinic, although there will be some of the effort that's being led by the First Nations Health Authority, including on Vancouver Island, will happen over this weekend there. But the other health authorities will be holding immunization clinics on January 1st. En français, je dirais que l'ordre présenté hier par la santé publique en Colombie-Britannique était nécessaire, pour ces circonstances. Je sais que c'est difficile pour des restaurants un peu partout dans la province, surtout maintenant. On a démontré depuis des mois notre confiance dans le secteur et je pense qu'en général, leur performance était excellente. On travaille avec eux et on va continuer de le faire. Mais il n'y aura pas de compensation pour cet ordre, mais cela étant, on encourage tout le monde de manger localement, d'acheter localement et j'espère que tout le monde va être derrière et en soutien et donne un grand soutien à nos petites entreprises, que ce soit dans le secteur des restaurants ou en général. Merci beaucoup. Thank you very much. Happy New Year.
Thank you, and this is all the time that we have today.
Wish you a happy new year.